Yeah. I don't know if they work, but just remember that this was, although it was, great for when you do all this stuff. These, these questions about where the things I would study, make sure you know where to do these things. Yeah, the fifth intercostal space. Yeah, this fifth intercostal space would be something I know. Okay, so the part that I thought that people would want to know, or that people don't grasp well, is the transition from fetal to adult circulation. How many people are, and what happens to the ligaments arteriosum and what happens to the foraminal valve? You want me to just go over that real quick? Yeah. Okay. So, and this is just a little talking point. So, when in fetal development, okay, on the right side of the heart, right side of the heart ain't doing anything, right? Right side of the heart is not pumping blood to the lungs because there's no lungs. The lungs are not expanded, and they're giving back pressure to the right side of the heart. Blood that comes in from the inferior vena cava, from mom, went right through the liver, through the umbilicus, and it's oxygenated blood. And now it comes in through the right side of the heart, but the left side of the heart, the left atrium, is not pressurized because there's no blood coming back from the lungs. So the left side of the atrium, the left atrium, is not pressurized. And the only place where blood is coming in is on the right side. So blood flows from the right side straight across to the left side and goes right to the left ventricle and then to the aorta. Okay? But over on the right side, that right ventricle is practicing. Okay? Blood is pumped from the right atrium to the right ventricle, and then from the right ventricle into the pulmonary arteries. It gets into that pulmonary trunk, there's nowhere to go. So there's a release valve that goes from the from the pulmonary trunk to the aorta, called the ductus arteriosus. Okay? So that there is some back pressure, and there has to be flow through that area, right? So the heart can get used to pumping against something. Does all that make sense so far? So then, the baby gets born. Somebody smacks it, and it takes a big breath. And when it takes that big breath, everything changes. What changes is that there is now no resistance to the blood flow going in through the pulmonary trunk. It now continues directly on to the lungs. And when it flows all the way through the lungs, it comes back through the pulmonary veins. And those pulmonary veins pressurize the left atrium. And now the left atrium and the right atrium have the same pressure. And since they have the same pressure, the flap, the foraminal valve that all that blood was flowing straight across to, closes. And once it closes, eventually it will get stitched shut by your body, okay, to make the fossa ovale. And since there is now the same pressure in the pulmonary trunk as there is in the aorta for a brief time, since those two pressures are the same, there's now no blood flow going back and forth between the pulmonary artery and the aorta. Does that make sense? Now, there is a kind of pump that actually uses fluid flow. If you pump fluid past a 90-degree turn, you will actually create suction that sucks fluid in from that 90-degree turn. And now you have both the aorta and the pulmonary trunk who have this junction between them that's a 90-degree turn. And so both of them are now creating suction that's closing the ductus arteriosus. Does that part make sense? Okay? Two things going at 90-degree angles to a fluid tube both create suction to close that tube. And that's how the ductus arteriosus becomes the ligamentum arteriosum. Does that part make sense? So how is it that you figure out that a kid has a patent foraminal valve? Usually it's suckling. When they suck, they're not just sucking air, right? They're trying to suck milk, right? And they're sucking so hard, this is good stuff, right? They're sucking so hard that they're creating negative intrathoracic pressure. What does that do? That not only creates the suction, it helps them breathe, but it creates the suction that sucks blood back to the heart. blood goes back to the heart to the right atrium. If you overfill that right atrium, those Starling forces you guys learned about, if you overfill that right atrium, it overfills the right ventricle, right? So that right atrium, when it overfills, instead of overfilling the right ventricle, it blows, it's now higher pressure than the left atrium. And it blows blood across through the foramen ovale into the left atrium. Are you with me so far? But that blood, unlike before, that blood is unoxygenated blood. And you just pumped unoxygenated blood from right to left and into their system. And so it's a baby who, when they're suckling, turns blue. And that's a clue. He got it. So that's a clue to someone who's got a patent foramen ovale. Okay, a baby that turns blue when they're suckling, because when they create that negative intrathoracic pressure, it starts to change where the blood flow goes across. Does that part make sense? Okay. I can stop right there. Is there any other stuff you want me to go over? Had questions on? Does that make sense as far as the change? That change that happens, and the switch that happens, and the flow dynamics. It's not magic. There's physics. Anybody have any questions?